Hello, this is Chelsea Dade, founder of Communicate for Health Justice LLC, and welcome to CFHJ's Soft Launching Justice podcast. Soft Launching Justice is a podcast exploring how young people of promise are shaping the future today by demanding more. Hosted by yours truly, each episode unpacks the systems youth are influencing and challenging today, from digital culture and public policy to workforce and leadership pathways. Through real conversations, this podcast holds space for emerging advocates who are leading boldly while challenging norms, even if we're all still figuring it out together. Subscribe to the podcast on YouTube at CFHJ. Hi, everyone, and welcome back to Soft Launching Justice. Today's episode is titled, Who Lives, Who Dies, Who Tells the Health Justice Story? Now, if you know me, you'll know I'm a big Broadway fan. This all started way back in 2008 when Wicked the Musical was all the rage. Shout out to Oakcrest Middle School chorus class for the introduction. But back to the podcast. This episode is focused on power, specifically how buzzwords dilute real movements, why narrative ownership in health justice is literally a matter of life and death, and what it actually takes for young people, especially those who grew up in the hyper-visible world of social media, to own their narrative rather than letting algorithms and institutions dictate it for them. I want to take you back to around 2018, 2019. While most of Gen Z was still in high school or college, I was fresh out of my graduate program in health communication, ready to take on the world through intentional and intellectual wordsmithing. When I was first starting out and decided to name my organization with the term health justice, the phrase health justice was barely on the mainstream radar. When you talked about healthcare or health advocacy back then, people were just getting comfortable with terms like health disparities or social determinants of health. Even the phrase health equity could ruffle some feathers. When I said health justice, people would ask, wait, do you mean healthcare policy? Do you mean legal advocacy? And I had to explain, no, health justice is about the intersection of systemic power, historical accountability, human rights, and well-being for all generations. It's not just about giving people access to a broken system. It's about restructuring the system so it stops causing harm in the first place. Fast forward to today. Look around your LinkedIn, public health conferences, grant applications, corporate press releases. Health justice is everywhere. And look, on one hand, a shift in language is great. It means the vocabulary is spreading. But on the other hand, we have to be real about what happens when radical concepts go mainstream. They get diluted. We saw it happen with health equity. 10 years ago, health equity was a sharp, transformative framework. Today, corporations throw equity into a banner ad without changing a single internal policy or shifting a dollar of resources. The exact same thing is happening to health justice. It becomes a trendy hashtag, a buzzword used to check a box, stripping away the actual systemic teeth the movement was built on. When everyone uses a term to mean everything, it ends up meaning nothing. And that's why who tells the story and how they define the terms is a battle for power. Because here's the truth. The people who define the problem are usually the ones who profit off the solution. When we ask who lives, who dies, who tells the health justice story, we have to look at who holds the mic. If a large institution gets to tell the story of a community's health crisis, they'll frame it through individual choices, lack of education, or simple bad luck. Why? Because that absolves the system of responsibility. But when the community itself tells the story, the narrative changes. The frame shifts to structural disinvestment, environmental racism, policy neglect, and historical trauma. And suddenly, the solutions required look entirely different. Storytelling isn't just creative expression, it is power. It dictates where funding goes, which laws get passed, whose lives are deemed worthy of investment, and whose suffering is dismissed as standard protocol. When we let institutions, performative allies, or corporate entities dictate the narrative of health justice, we surrender the power to demand actual structural change. This brings me directly to young people and rising advocates today. If you are a young person entering this space, you are living through an unprecedented moment. You grew up on social media. Your entire life, your milestones, your advocacy, your personal struggles have been mediated through screens, trends, and algorithms. And while social media gives us incredible tools for connection, it also creates a massive trap. It makes it dangerously easy to let other people dictate your story. On social media, the algorithm rewards what is trendy, palatable, or dramatic. It encourages you to compress your complex lived experience into a 15-second reel or a prepackaged, bite-sized trauma response graphic. Without even realizing it, young advocates can fall into the trap of performing their story for an audience or adapting their message to fit whatever the current trend demands, rather than grounding it in their true, authentic voice and purpose. So you have to ask yourself, am I sharing this story because it's mine and it builds collective power, or am I shaping it to fit what an algorithm or an institution wants to see? Owning your story means refusing to let it be sanitized. I'm going to say that again. Owning your story means refusing to let it be sanitized. It means taking the time to understand your own values off camera, away from the likes, the views, and comments, so that when you step into public spaces, no one can co-opt your narrative or use your experience as a diversity shield. And this is why this podcast exists. Soft Launching Justice isn't going to be a space where we just repeat the trendy buzzwords of the day. We're going to dig into the roots. We're going to question who holds the mic, challenge the watered down narratives, and highlight the real, unvarnished work happening at the intersection of health, power, and justice. Until next time. Thank you for listening to CFHJ's Soft Launching Justice podcast. We hope today's conversation gave you something to think about and something to act on. To prevent health justice from becoming just another buzzword, much like health equity did a decade ago, join us in taking real action. Follow CFHJ on social media, refer us to a potential client, or pitch a new collaboration. If this episode resonated with you, take a moment to share it, leave a review, or send it to someone who believes in youth voice and health justice. That's how this community grows. If you would like to be a guest on the podcast, you can learn more about joining us at cfhj.org and on social media at CFHJ. Until next time, keep asking questions, keep pushing for justice, and keep communicating.